this is the agenda that I want to go through today. I want to talk about real quickly the Smile Wizard promises, the things that we promise you if you will use it often, things you will you will get out of it. I want to go over complete exams, getting patients into records, and that's what Angie's going to talk about. Um, I want to talk about and go through some treatment planning. So we'll pull up the Smile Wizard and we'll go through some of these things. I do want to show you various tips and tricks. A lot of people don't know some of the functionality that is actually in there, but things that we've learned over the years that we've implemented, et cetera. And I want to go over a new functionality. There's been some new functionality that either is about to drop, or for some of the people it did drop. But those are more of people that are evaluating it. Um, I want to end with the Smile Wizard community, and then we'll go into the QA. So, without further ado, just very quickly, these are the promises. And as you do and schedule complete exams, and as you're going through these complete exams turn into complete treatment cases. Okay. I cannot emphasize that enough. Dr. Dr. Dawson was very adamant about this. He had a certain process, procedure, etc. As it builds your patient's trust in you, your confidence in your dental work will be magnified. It reduces mistakes and redos because it is, again, just a giant checklist. It saves time and money, and it reduces stress. And you will actually be able to have fewer patients and higher earnings. And also provides legal protection through documentation, et cetera. But the most important thing is we need to get patients into records. And so I want to open this up to Dr. Hedlund, and she's going to talk about that. We had a little bit of discussion about that last week in New Jersey. But Angie, what's your mindset like when you're thinking about how to get these patients into records?
So the patients can come in the doorway in our practice in four different ways. And those are, an emergency exam. We all have patients that come in with emergencies and they've got a chipped front tooth that we need to help them take care of. They've got a broken tooth in the back. And we want to be sure and address their chief complaint in some way and help them to become more comfortable. So we certainly allow them to come in for an emergency exam. Another thing that we do is called a meet and greet. And these are for people who are kind of shopping around and, they're not sure if they want to make the commitment to a new patient hygiene appointment or a complete exam with me. So we'll invite them in to come do a complimentary 30-minute consultation visit. We call it a meet and greet. And it's really mostly all in the consult room. And we just go through. We give them a tour of our office. We give them a gift and a letter that we give new patients. And then I come in and the assistant or the auxiliary has already done their part of the preclinical interview. And I'll come in and go through my part of the preclinical interview. And we encourage them, that the next step is we want to do a complete exam and take a look at everything in their mouth and find out what would be the best way for them to achieve the goals that they've mentioned to us in the preclinical interview. They can also come in first with the complete exam with me, or they can come in for a new patient hygiene visit. And whatever visit they come in for, any of those four, their next visit is going to be for a complete exam. Or if they come in for the complete exam first, then their next visit is going to be for new patient hygiene. And I used to be really rigid when I first started my solo practice. I practiced with a group for 16 years with Ron Goldstein and David Garber and Maurice Salama in Team Atlanta. And then 14 years ago, I opened a solo practice. And when I first opened, I thought, no, everybody's going to come in for a complete exam first. That's going to be their first visit. They're not going to come through hygiene first. It's always going to be a complete exam with me. And I decided, that's a really good way to go out of business. And I've just learned over the years that, there are simpler ways to reroute people, meet them where they are. And, sometimes maybe they come into hygiene 2 or 3 times before we talk them into coming in for a complete exam. That's not the norm. That's probably fewer than 5% of our patients. Most patients right after their new patient hygiene visit come in for the complete exam, or they come in for the complete exam first. And we just have one simple sentence on the phone to kind of determine, between those two, if they just call and say, I'm a new patient, I'd like to schedule an exam, then we'd say, great. Would you like to come in for your cleaning and checkup? Or do you have a specific need that you'd like for the doctor to take a look at? And so that's kind of how we determine where they come in. And then if let's say they've come in hygiene for their first visit, then I'll go in, and at the end of the visit, after the hygienist has done their full set of x-rays and done their charting, and if they're healthy, she may go ahead and do their prophy. If they have disease, obviously I'm going to come in and we're going to talk about that. And I tell them that I'm just going to come in today just to meet them, and I want to take a quick look around their mouth to see if there's anything urgent that we need to address, but that I want to invite them back into the practice to do a complete exam, and that this is something that we offer all of our new patients. And it might be something that we only do once every 5 or 10 years, just based off of, what we're seeing as far as changes or breakdown or anything in their mouth. But that it just gives me more than the 5 or 10 minutes that I have in the hygienist's room to check their jaw joints, check their bite, check their soft tissues really thoroughly, and check each individual tooth for health or disease. And we actually have a handout that I've shared with Travis that he can share with all of you. And it's just called the Complete Oral Examination Handout. And it just describes what we do at that visit, so they understand, what that 90 minutes that they're coming back for entails. And one thing that has really helped us is, if a patient has insurance, we actually go over this with them at their first visits. Like, say they came in for their new patient hygiene visit first, and we walk out or charge out the complete exam at that first visit, because that's when their insurance will cover it. And we're rescheduling them to come back and do it. I'm doing an exam at that visit, like a periodic exam to look for anything urgent, but we invite them back at no additional charge to finish the complete exam. Now, if they're a self-pay patient, you can just charge it out at the next visit. But that is one thing that we have realized, that the insurance company is not going to pay for their complete exam if they've already had an initial visit into the office. And then based on the information from the complete exam, then we determine, we tell them that sometimes, based on our findings, we're going to need for them to either stay that day or come back for some additional records to take a look at things a little bit more closely. Is that kind of what you were interested in, Travis? Or you guys have any more specific questions about that? Did I cover?
No,
I know you
sorry.
said there was a specific thing that you were looking at. Like, one of the things we use is the tire analogy. I don't know if that's one of the things you were thinking about, but when a patient comes in, let's say their first visit is for an emergency exam and they have a broken tooth, then one of the things that we talk about with them is, we can put a crown on this tooth that's broken today, but I want you to think about this like the tires on your car. There's a reason that tire went flat. There's a reason that this tooth broke. And we don't want the new crown that we put on here that you invest in to do the same thing. So we'd like to invite you back to do a complete exam and find out, why this tooth broke. And if we can treat the cause for that, then this crown's going to last as long as possible. And you're going to, have fewer teeth that would break in the future, hopefully no teeth that would break in the future.
Perfect. Yeah, that's exactly what we were looking for. And just as far as this letter goes, I'm going to share this letter with everybody in the actually I'll talk about how I'm going to do that later, but we do want to make this available to everybody, and you can feel free to use it as well. Obviously, you're going to change the name, etc. But and on the screen, I think I'm sharing that, right? On the screen there, you can see kind of what it's all about and how Angie talks about it. Um, so thank you very much, Angie. That was
Yeah. And
awesome.
one thing I would love to mention, and I sent you the graphic, Travis, if you don't mind putting it up, but I sorry y'all, I'm at the beach with my 16-year-old, and I evidently didn't bring my laptop charging cord, so I'm on my phone, but I'm excited to be here with you. And I wanted to tell you about our resins course that we're doing at the Dawson Academy in the month of October, because I think it would be a great class for any of you who haven't been through it yet. And we actually go through a case in the Smile Wizard. We go through the particular case we go through is a single discolored tooth. And in this resins course, we're going to teach you how to do an invisible class 4 composite, how to mask a single discolored tooth, and how to do a full mouth reconstruction, a bite opening case with composite resin. And we go through a case from beginning to end. So we do the whole complete exam in the wizard, and the 2-dimensional workup on that patient, the 3-dimensional workup. We go through his imaging, the wax up, and everything from start to finish. So I think it would be a beautiful way for all of you to see not only how to do incredible resins, which is something that's very valuable to your practice that you can go back and use on Monday morning, but how to incorporate everything that we're teaching you at the academy, as far as not skipping steps when you're doing your complete exam in 2D and 3D treatment planning. Because I was meeting this week, my office and I are switching dental software. We're going to a cloud-based dental software, and we were their headquarters happens to be in Alpharetta, Georgia, where I practice, and we were there talking to the head of the company and some of the people on our team, and I was talking to them about Smile Wizard, and I said, it's the one thing that if you took this away from me, I couldn't practice dentistry that week, because and I'm here talking to you about it not because Travis pays me or anything. I'm here because I believe in what we teach you all at the academy, and the Smile Wizard is the best tool that I have seen to incorporate everything that we teach you from start to finish, all the way through the complete exam, all the steps of the functional aesthetic checklists that are the 2D portion of the wizard, and the 3D treatment planning. And I've seen what a difference it makes in my practice. I mean, I've told stories on other webinars that I've done that some of you guys may have seen about, going over cases. And when I can finish a complete exam and then step into the consult room with my patient and show them immediately, on their imaging and from what I've done 2-dimensionally in the wizard, what things in their smile aren't ideal and how we can change things for them. I mean, they are ready to move to the next step the same day. Oftentimes I've had people ask, so what do we do next? Do we just write you a check to get started? And I've had people that have come in, and I've been their third dentist that they've done a consult with. And in one instance, it was a husband and wife, and the wife said, well, I don't know, she's a little bit more than these people that we went to. And her husband said, yeah, honey, but nobody did anything for us like this, So this is really practice building. It is, and it's such a minimal investment for a great way to implement everything that you're investing in learning already by going through courses at the academy. It pays for itself 100-fold right away. So very
Thank you.
excited. And if there's any other questions about anything, I'm happy to address that. Anything specific about the new patient process, or please let me know.
Awesome. And we'll have you back on one of these probably later on, because I'm sure there will be questions, but we unfortunately need to get to the training. But I will tell you that Angie is Dr. Hedlund is probably one of the reasons I decided to take this on, is when people tell me that they rely on something like this to practice. I was actually involved with it very from the early stages, and we were able to get it released and everything. And I also believe in it so much. So thanks, Angie. We'll let you go
Happy to
from
be
now
here.
on, and we'll
Okay,
follow up with questions if they come your way.
great. Thank
Thank you
you.
so much.
Bye.
And again, I will be posting this, like I said, as well. So to be successful with Smile Wizard, number one, you can't do it by yourself. Like she said, like Dr. Hedlund said, you can't really do it by yourself. You have to sort of integrate it in your office. It has to be sort of something that everybody is helping the patients through and to do. Just last weekend, we heard Dr. Burwitz talk about how he integrates it into the practice, and he probably only has um, he says he probably does 30% of it. The rest of it is done by the office and how they're going to do it. So, and that's another thing that Angie talks quite a bit about. So don't be afraid to implement it. You should use it. You should get records scheduled for people, some of your patients. Um, One of the things people talk about the fee, and the fee is typically a little bit more, and it's obvious that it would be a little bit more because you're spending a lot of your time doing these things, and so that's one of the biggest reasons. I would encourage you to start a case in Smile Wizard, go through a complete exam. And this is what I'm going to show you now. I want to start a quick demo of this. And so I'm going to bring up my Smile Wizard. So I got Smile Wizard here. Okay, now this screen, obviously nobody's going to get that when they log in. It's only an admin user like myself that would get that. So integrating this into your practice is one thing, and getting people into records is another thing. Um, the other things that we wanted to talk about on this were the that there's some new functionality that I want to go over. I want to talk about treatment planning, and I also wanted to talk about new functionality. So we're going to kind of roll these up into doing them sort of all at the same time. And I've got some notes that I'll come back to. So just as one of the tips, I was recently just asked by somebody who's used it for a while. They said, the only thing that bothers me about Smile Wizard is when I come into the patient management screen, I have to search for everybody because my patients aren't there. Well, one of the tips and tricks is if you go into your profile, so on the upper right-hand side, if I click on profile, it comes into this screen, and I've got general, and that's most all of the settings in Smile Wizard are here. I've got this tab for plans, and this happens to be the plan that I happen to be on. It has order history, and if I want to switch to a new plan, I can do that here. And then there's a staff. So, and these are just sample data, but some of this information is if you want to share this and you really get it integrated into your practice, I would highly recommend adding staff logins. You can add an assistant, or it really can be anybody, but give them a login so that they can log in on their own. A lot of times when you go to log in, there's some HIPAA things that we've put in place to keep the information private and make sure that nobody's logging into your account that is unauthorized. So use this staff logins. You can add an assistant. It basically just emails them and authorizes them to be a user on the account. Okay. I want to talk a little bit more about in the profile here, the person, for example, that was telling me that they had to search for everybody. One of these last patient settings down here is I can show all patients by default, and I think this is turned off by default. And so if you want to come in here and change that, you can do that. You can also, if you are showing all patients by default, which I'm doing, you can also apply a blur effect to the patient cards. And when I go back to my patient management, that's what you see here. You see everybody by default, and it's sorted here by newest to oldest. So somebody that just came into my practice. But it's if I go in here to, for example, this is Ashley Brooks. If I come in here to this example and I do something in there, all of a sudden it becomes the newest and sorts everything down there. Another thing that I wanted to show you is you will notice on some of your cards, there is this little icon here, and behind that it says student. So that is a learning case or a student case inside a Smile Wizard. What that means most often is that somebody and most likely it was either me or some other admin user that sent that case into your account. So if you show up for a mini residency class and you have some of these things that say student on it, just know that that is for your ability to look and see that case and look at the images and look at perhaps maybe the diagnosis and understand. So it is not typical, it is not one of your own cases. We do have people that go into the mini residency program, and actually there's some other people who signed on to the Smile Wizard because they went to a study club. It's but the same thing will happen in these study clubs. Somebody will send you a case, and it'll just show up there all of a sudden, and that's what that indicates, is it's just a student account. Um, we do have, as you notice, somebody, Dorada, logged in from Poland. This is actually in 4 different languages, um, but you can change the language there. So another thing that I get a lot is, let's see, these the settings. You can choose the verification method that is most convenient for you. For example, I want to log in at least once per week. It's going to remember, it's going to relog you in. And the browser, if you have like cookies enabled, then it will allow you to just click on it and go into it because your password will be saved there. But every once in a while, we want you to log in on your own. And you can actually turn this off. We don't recommend this, but if you say never, I'd rather manage the risk myself. A lot of people have multiple people logging into their account in the office, but that is one way to turn that off. So let's get into the exams. And so I'm going to use Marin Maxwell, and so when you use Smile Wizard, you want to start, well, you can open up this screen right here, and it just kind of goes in order of how you want to do these things. When you get somebody scheduled for records, um, when you get somebody scheduled for records, this is kind of the first thing you will do. Okay. And this button over here that says start pre-screening is typically you would click that for a new patient and they would be able to start that. So if I were to click that, it would just basically come into the same here, the exam. And I will say that this exam is the complete exam. There are 17 tabs across here that you want to use. And if you do all of these, and a lot of people, again, I will just say this as a caveat, not everybody does every tab, and they don't necessarily do every tab in the order that it is on here. This is what was originally prescribed when we programmed the Smile Wizard, but you can really kind of do it any way you want. One thing that we want to do in the future is allow people to move these around on their own and be able to do it in the way that they want to. Um, but this is the way it was originally designed, and we haven't gotten a lot of feedback about this, but we want to do that in the future. And really, you would just go through each one of these. What is your chief complaint? Do you have any significant dental history that we need to know about? And what aesthetic concerns do you have? This kind of sets the foundation for this case. This is information. I have people, again, that use Smile Wizard. They'll come into here and they're like, oh, you know what? I never asked about aesthetic concerns. Why don't I ask about aesthetic concerns? I need to be asking. I need to track these values, etc. Or why don't I talk about their dental history or ask them about that? One of the first things you'll come in here to do is the oral cancer exam. WNL means within normal limits. And then if there's any pathology and a description that you want to put in there, you would put that in here as well. I don't want to go through everything because this really is meant, I mean, it's a self-guided examination. And you ask TMJ questions. A lot of these questions don't ever get asked. It's important to ask these questions. And even before somebody comes into records, this is one of the things that are very important to talk about. We need to understand these things. Does your jaw open? Does it lock open, for example? I don't know how many times I've been to the dentist and they had no idea that there are times when my jaw will lock open and I have a hard time getting it closed. Muscle examination. Um, this is more TMJ questions. How does your lower jaw slant when it comes open? Again, I'm not a dentist. I know that's not the correct vernacular. Um, and I want to kind of go into auscultation, left TMJ, right TMJ. Now, number 8 right here, I want to caveat this by saying this is a new change. It used to have, if I were to click here, it used to didn't have the none, but it did have some of these other possible answers, and we realized we needed to change it because if the wear is general, but there's mild wear generally in the mouth, then you would want to click on these two. If it's local, then you might choose something else. There's exposed dent only in a certain local area. Or if there's none of that, then you would just click on none. And then there's tooth mobility, crowding. So that's one of the changes that we made recently. It used to just be all of them, and it was a little hard to understand. So we made a change there. So I'm going to go ahead and save this. Occlusal stability talks about the airway, obviously. And there's a lot of changes here. For example, on malocclusion, it used to just be one of these three, and you can actually have multiple. So we just changed this recently. And for those users who have been using this for a while that have logged in, you now have the ability to do that. New users, you will probably never know a difference. And again, the color schemes are yellow is something that we need to look at, something that we need to pay attention to. And anything that's in red is something bigger that you need to definitely be aware of. We go into stop bang. I ask all the questions about stop bang, Patty score, aesthetic smile analysis, um, the skeletal analysis of the face. It asks people if they're happy with their smile. This is all very important information that goes into creating the complete exam, periodontal concerns, etc. And then there's this last page that you would have to come back into in order to go tooth by tooth and do a tooth by tooth analysis, which according to the Dawson curriculum is typically towards they would do this towards the 3D checklist, which we'll get into here in a minute. But again, this is the exam. This is the order you want to kind of do those things. Okay. And so the next one on the list is photos. I wanted to talk a little bit about photos because a lot of people didn't know that you can take your images, and a lot of times these images will either go on a card, like an SD card, or they will go into somewhere in the office. If you have the photos in the right order, and again, it kind of depends on how you're labeling these. If you have them in the right order, if you just drag and drop the 21 photos here, then it will cascade them all the way throughout the 21 photos. Again, not every office does it exactly like this, but it is there. And again, I can take these and drag and drop them around. Obviously, I don't want to do that. While that's updating, I'll take a quick drink. Whenever I talk a lot, my throat gets kind of scratchy. So really what I want to do is now put that back in the right order. And again, new users, all of these photos now, you have to line these up to where they are. This has to be a full smile. This has to be the E position, tip down smile, because what it's going to do is it's going to use those photos every time in the right places during the examination. So Another one of the things that people wanted to talk about was treatment planning. And the treatment planning goes in that order. However, I do want to mention that you can upload other photos. If you scroll down to the bottom here, you could, for example, change this label, and I'm just going to call it new label and click good. And that label could be, I want to do a photo from wherever, or maybe it's a still shot of your um, of a 3D image that you particularly like or need to get back to. It could be a CBCT image, etc. Okay. I just want to point out though that you can change these labels down here and you can put extra photos in here. That was something that we got quite a bit years ago. Or you can also come into miscellaneous and you can upload other photos that you want to. And again, you can change the name. These don't have to be CBCT images. They're not used downstream as a CBCT image. MRIs, anything that you can export into a common media format. And T scans, I don't know how many people use T scans, but even T scans can be played. They can be exported and then imported into Smile Wizard. And this is just a T scan that's used. And this is one that I just use as an example, but you can actually play those. You can go in there and go forward and backwards. So I would encourage you to use that, upload the photos that you need to, um, etc. So, and then there's photos. Oh, let me just, here's another tip or trick that a lot of people don't know about. If I go into the photos section here, and I, for example, want to do a close up on this, the tip down smile, I can just click on this button and it will open this image to bigger so that I can see it a lot better. Okay. This is very handy if you're using this, for example, um, in front of patients to really get a good view of that. Um, and you can also flip about the y-axis or flip about the x-axis. And that typically comes in really handy when you're doing these upper occlusal and the lower occlusal images because they're obviously done with a mirror. And a lot of times that doesn't come in the right way. I know certain cameras do it a little different, but you can manipulate these as needed. But any of these will open up. You can draw on these if you want to. You can see how I can just, if I wanted to highlight something, etc., I can do that. I can undo those. And it's just maybe if it's like taking notes on the photo itself. So once you have the complete exam done and you upload the photos, you take the photos, etc., now you're ready for the 2D exam. And then the 2D exam, I want to go through this a little bit, but I also want to talk a little bit during this about some of the changes that were just made here as well. Not many of them. If I go into, so I'll get to this here in just a minute, but these are the first two things. If this has never been asked before, the first time you come in to do the checklist, you have to answer these questions. Is the airway acceptable? Yes or no. Are the TM joints stable and healthy? Yes or no. Can they comfortably accept maximal loading? If the answer is no, then there's this button right here, this start checklist button does not come up. And the reason is that as a dentist, you need to make sure that these things are good to go before I go into this. They need to be taken care of first and foremost. Well, then you would go into the rest of the checklist. And this first one here is these are the 5 requirements for stable occlusion. And what am I going to do? My options here are I can reshape, reposition, restore, or reposition the bony segment. There's only 4 things that can be done here. But I go from that requirement to the next requirement. Um, and one of the really cool things about Smile Wizard is we typically want to show what the goal is, and then we want to show sort of where the patient is at. There's a a process that's called co-diagnosis. And when you do co-diagnosis with your patients have more trust in you. And that's why it's important to show some of these things that we're talking about, especially my opinion in the 2D checklist, because you're kind of walking through this and you can sort of be you can be the neutral observer. Okay. The software is going to tell you what the goal is and then what the requirement is. And you can point out that they're not meeting that. You're not the bad guy. It's not your opinion now that something is bad, right? Um, because you are the observer. You know, you don't want to get sales breath, if that makes sense. You want to be you want to stay the observer as you go through these things. But one of the things that it tries to do as you go through these is there shows you the goal, and maybe you could point out where the other person where the patient is. Um, and again, you can explain these things. Maybe in this one it's a little bit too detailed for the person, but as you get into some of these others, like the skeletal analysis, now that I have these photos, I can start lining these up and saying, am I 2 to 5 millimeters? If I line that up with Arnett's true vertical line, where do they line up? Showing this to a patient is saying, you're here. This is the goal. We're co-diagnosing this, and it's engendering trust. Where's my lower lip? Where's my chin? And as I click on this next one, the nasolabial angle, for men and for women, it's going to be a little bit different. But for men, you want it to be 90 to 95. And you can just see how that's switched. There should be something on this screen that helps you understand that switch. But it shows you what the angle is, 96 degrees. Okay, well, it's just out. Well, it's just short of that for a woman. And if I click on this last one here, you see the Ricketts E-plane, it all of a sudden jumps as well. And it shows you the goal. Some of these things can be very good for the patient to see. Okay. And again, answering all these questions. One of the things I didn't mention about the 5 requirements of stable occlusion is that this is a wrap up. If I'm taking notes on requirement 1, they're staying here. And then I go to requirement 2, and I can check on, I got to reposition, restore, or reposition bony segment, or reshape, which in this case, it didn't come out of that. But it's a roll up of all those notes. You go into some of these other tools, and I'm not going to show all of these. One of the changes that was just made is on number 8 here. And Angie, if you're still on, maybe I don't know if you've seen this. I think you have. But sometimes we want the full smile, and sometimes there are times when we want to see E position. Okay. For some
Yes,
people, and
and
Angie
I'm
had
here.
yeah, and you had a case recently where this was prominent, correct?
Yes, yes. And I was trying to remember the exact circumstances. I'll let you continue while I'm thinking about
Okay, no worries.
exactly what was going on with him.
So that was a recent change that was made. And again, all of these pictures are pulling from your photos. So they're already there. They're already waiting for you when you go into your 2D checklist and you run through this diagnosis. I'm not going to go into this right now, but there's a section here where you can measure you have a measured width and an ideal width. again, I'm not going to spend time here. I typically get a lot of questions on this, but I have recorded a couple of videos that if you need a refresher, you could probably go back and watch. And I'll wrap this up when I get to the end, and it'll show kind of where those things are. Um, so ideal height and width for the front teeth. And again, all of this stuff is a guide. It helps. The cool thing about Smile Wizard is it's a checklist that if you go through it and if you stay on task, it will recall these things for you. You will get better and better at it. And you probably will eventually at some point say, you know what? I am getting better and better at this. I can anticipate what the Smile Wizard is going to ask me for and what I need to do. And it will you'll gain confidence, etc. And it's really, really cool to see. So with that, I want to make sure and get back. I'm going to go back to the presentation real quick. We did the demo for the 2D. Navigation, we went through that. Again, you just want to start at the top and work your way down and work across to all of those. We talked about patient management. There's another thing that I wanted to talk about here. Whoops.
And I remember the change that we made because of that case. I think now we're populating the e-smile photo in there when we're evaluating the height of the gingival tissue in relation to their upper lip, because we've noticed that a lot of patients in their regular smile photo will compensate, and you won't be actually able to see how high up their lip truly goes, if that makes sense. You know, when they're doing their regular, when you just tell them to smile. If we do that e-smile, then we can really get the position of their upper lip in relation to that gingival tissue to see if we need to do any tissue raising or anything like that.
Right. Perfect. So the other thing that I was going to show is when you have, I'm going to go back here real quick to patient management. These are all my patients. You will see that this Ashley Brooks, she actually has 3 visits, and which means that she has been into records 3 different times. Okay. If I click on her name and I go into view other visits, there's 3 different ones in here. This one I think has the same image, but it was done at a different time. But you can tell that the photos are slightly different. If you want to come into this patient and start a new visit, you can, when you're back on the patient management screen, I can click on these 3 buttons here, and I can unite patient records. So people who have been using it for a long time, this functionality was not there, and you actually had to go in and start a whole new person, and then you had to either change the name of the visit or you had to do something different. You can't have 2 patients with the same name, and but they wanted to go in and put it in new records, etc. Well, that's how you would do it. If you click on plus, it's add a new visit. Sorry, my mouse is huge. Can't really see behind there, but it says add new visit. I could add a 4th visit for this patient if I wanted to. I can delete it from here, or I can edit her information from here. So I just wanted to point that out. That's sort of a tip that not a lot of people know about or use. So if I go back, we talked about settings and how to change some of your settings, multiple records. We've uploaded images and extra images. We've talked about staff logins. Again, a great, and again, when you're doing this, you don't want to go this alone. You need to sort of have that mindset of getting people into records and sharing the workload across your workflow with your office. So it looks like we did a lot of these things. So we got about 10 minutes left, just a quick time check. I want to just show new functionality that just recently. And I will caveat this with saying this has not been released for everybody. If you are anxious to look at this and try this new functionality, please do, or just send me an email, and let me know that you want to. Let me know that you want to use it. I can add it. There's one thing holding back the complete release of this, and I need to check with the doctor who helped me put this all together. But if you go into, oops, if I want to, for example, go into, and I was kind of showing this earlier, airway and TM issues are paramount. We need to absolutely take and do these first. Is the airway acceptable? If their airway is not acceptable and you want to continue on with doing some treatment, you used to have to click yes, and it was kind of like lying that it was acceptable. And then you would continue on to do some of the things, because there are some things that you can do beyond this point in the 2D checklist. If I say no, but I want to continue, I can type in a reason here. And did you see this button highlighted all of a sudden? Because as long as I say no with a reason, I can continue on. And it's the same for the TM joint question. But I also have this analyze button that just showed up. If I click on analyze, is the airway acceptable? It's going to take me through a quick, it's like a decision tree. Has the patient ever been fitted with a provisional sleep appliance? Yes. Should the patient be referred to a doctor for a sleep test? Yes. And you can put in the name of the referring doctor. Once you have that in there, you can continue on. Is there a diagnosis? Not yet. Okay, well, let's continue with normal treatment. So I hit save and return. I had my reason in there, and it helps guide you. The one that I think is even better is this TM analysis, TM joint analysis. If I click on analyze here, it's going to walk me through, well, where is the pain? With one finger point to where it hurts the most. And they're going to say it's either behind the eye, it's in my temporalis muscle. Sorry. It's behind my jaw, it's in my jaw joint. If I select one of these, it's going to save what I've put over here on the right. If you had a recent dental injection for lower teeth, have you had? If the answer is yes, then it's going to say, is there a significant reduction in pain, free range of motion? Yes or no. If there is, then it's possibly, it could be trismus. I don't even know if that's how you say it, but it walks you through this. If I want to start over, I would go back into here and say, maybe it's on the mandible. Is the pain worse when eating sour foods? Yes. Problem with the parotid gland, etc.
Yeah, parotid gland. Yeah.
Yeah, the parotid gland. I knew that didn't sound right. I've heard the word, but I have no idea what it means.
That big salivary gland in your cheek.
I see. Okay. So this is a guide, and again, it is not saving my reasons, and it's coming back. That's quite possibly a bug. So if I have those requirements met again, and this is a way that you can analyze these important issues for patients. That's why we added it. I start the checklist. I just want to make sure, yes, my reasons are saved now. So this is functionality most people on here probably don't have, but I will be putting that out there very quickly. And again, if you want to contact me and be added to the test group, send me an email. Travis@lifecycledev.com is my email. So let's go back here. I showed you corrections and exam. We went through that, the 2D corrections. We went to that and showed those. And so the last thing that I want to mention is oh, whoops. I need to go to Smile Wizard. So if I go to Smile Wizard, you should all have now, and you may have or may not have noticed it, the Smile Wizard community in the lower right-hand side. I want to make sure that you guys are taken care of, that you have what you need. I'm going to be posting, maybe I'll post this training out there, but we have a community website that you'll be able to get continue support from. And possibly doctors like Dr. Hedlund and Dr. Burwitz and others have have agreed that they're more than willing to support that, and maybe through our help with them, maybe they can get some of your clinical questions answered, etc. um, but it's a community where I will post all these videos. I will post and you can recommend more videos that you want. For example, I'm just not quite getting the ideal height and width with a perhaps with a patient that has a diastema. Let's talk about that. Let's post another video that goes over that. I want this to be a place where you are, um, where you have that support that you need, and you're getting answers so that you can be successful with it. If you are successful with Smile Wizard, you will be a successful dentist. I really believe that this software is the Dawson curriculum in a software package. It will help you follow the steps. It will help you stay on track. It will help guide you, and it will really help you become more comfortable in doing complete dentistry. And
Yes, it'll help them implement what they have made such a big investment in learning over these last few years.
yes, and this as well as study clubs do the same thing. I just attended a study club, so it's top of mind last week. Um, so I want to answer any questions that people have. How can we access Travis's tutorial for the golden proportion? Great question. I believe that that is already in the community. I have a video on that and how to use it in the community. So what's going to happen is you guys are probably opening up your Smile Wizard right now and clicking on Smile Wizard Community. What it's going to do is bring you to this page, and it's going to say, remind me of your email. You'll put your email in here and you will send it off. And I think what it does is it gives you a code that then if you go in and use that code, you'll be able to get in. I don't know if there's going to be immediate access for everybody or not, but I will see these come in and I will add you to these things so that you will be able to you'll be able to log in and get access to this other stuff. So it's something that I'm super excited about. I don't know how much it will be used, but I know it will be helpful. And if we post all of the support items and the help videos out there, et cetera, I know that people are going to use them. So thank you for your time. I know we're sort of out of time right now. We got a couple more minutes. Is there any questions that anybody else has? If you want to just post it in complete exams, typically as the dentist does the exam in the top or in the operating with the assistant filling in the info to the software, typically how long does that take to enter all the info in the op during the exam? I guess you get faster as you do more. That is completely correct. You will get faster as you do more. I don't know if Angie, if you want to talk about how you do it in your office real quick. How much of it do you do versus your assistants? Do they preload things for you?
So we actually take the photographs first, and then I go back and load the photographs. And there's several portions of the exam that I can do from the photos alone. And then while I'm doing that, there are portions of the exam that my assistant can do without me in the room. Like I've taught her how to measure the overjet and the overbite and the percentage. And she goes through all of the questions about the TMJ. She goes through the airway questions. We cut a cotton roll so she can measure the palate. So we're kind of both going through portions of the exam that we can do separately, and then we come together and finish the parts that we need to do together in the operatory. And I have that in a webinar that we did for Dawson about the wizard, which it's fine with me if we share any of that or cut pieces of it up to share with the community. But
Okay.
and I've got lists of like, these are the specific parts that I do from the photos, and these are the parts that she does in on her own in the operatory while I'm working on that. So, and
So
I mean, that really cuts the time down a lot. I mean, the patient's still there probably an hour between, especially if it's their first visit and we haven't done their preclinical interview and we're doing all the photos, you know, and the complete exam, and my hygienist slips in to do a perio chart and everything. But, you know, going through the wizard part and the photos and everything is about an hour. And then depending on if they need an FMX and if the hygienist is going to slip in to do charting, maybe 90 minutes.
okay.
And it does get faster. And if they don't have a lot of disease and problems, it's definitely faster than, you know, people who, you know, need restorative on every tooth and got wear and migration and mobility and all that kind of stuff.
Awesome. So I was just asked again what my email is, travis@lifecycledev.com. I just posted that in the chat. Once this ends, I don't think you'll have access to that. So if you want to copy that real quick. And again, we're going to send this out to everybody so that you can review it, etc. Hopefully you all got a lot out of this. I know it was great putting this thing together. Love to be able to support everybody on the call. Angie, thanks so much for logging in. Super helpful information. And like I said, I think we're going to do this again. We didn't really talk a lot about 3D. That didn't rank very high as far as like what people voted on, etc. But we can definitely talk about that. I do want to time box this though. Everybody have a great weekend. Everybody be safe out there this weekend. And I hope you guys get a lot of have a lot of fun. Dawson Academy calls it blue time. So thank you so much. And we will
Thanks,
be
Travis.
talking soon. Thank you.